Hello, everybody. Thank you for participating to this new clinical webinar about the G-WALK. This is Marco from BTS. During this webinar, we will talk about the clinical experience of using the G-WALK. We will discuss in particular about why to assess to gait and motion in neurological clinical practice. This is a tricky question, so we invited Christian Huber of Praxis Lamprecht Clinic in Germany to share his daily clinical experience in physiotherapy and to answer to this important question. So now I would like to introduce Christian and let him have the stage. I just want to mention that at the end of the presentation, we are available for any question. So you may ask the questions, just type in the question in the chat area. So I thank you again, Christian, for this opportunity that you are giving to us and for your availability.
Yeah, okay. So welcome everybody to the clinical webinar, and today the topic will be how Marco mentioned neurological patients and why to assess the gait and the motion in clinical practice. So first of all, I want to mention my mentors because I'm a big fan of this when it is due, and they learned me a lot. So let's talk about the Lamprecht Clinic. It's a rehabilitation clinic located in Kirchheim in Germany, and they are operating in the rehabilitation field for over 30 years and providing high quality therapy, counseling, and also healthcare. It counts on a unique knowledge in the field of neurology, for example, Parkinson's disease, multiple sclerosis, and of course also the stroke, orthopedics, and geriatrics. So Hans and Sabine Lamprecht founded the HSH Lamprecht Clinic in 1987 in Kirchheim, and by the end of 2006, the practice evolved into an interdisciplinary therapy center with 40 employees on 1,000 square meters. In 2009, Sabine and Hans Lamprecht opened a praxis for physiotherapy and neurorehabilitation with medical training therapy at the Eisbär House in Kirchheim. So to the history from 2009 to 2014, due the high demand, the workforce and the therapy areas were expanded. Sabine Lamprecht is now well known across the country as a lecturer for further education and also in colleges, where she plays an active role in teaching activities in Austria, Switzerland, and also in the European countries. And they are also authors of specialized books, for example, training in neurology and hypotherapy. So the services nowadays of the Lamprecht Clinic are the whole spectrum: general physiotherapy, so general practitioner, but also occupational therapy, speech therapy, medical training therapy, and hypotherapy. The clinic is also equipped with the most advanced technologies in the neurorehabilitation field. For example, let's mention the FES, functional electric stimulation of Bioness, the Terra Trainer Lyra Gait rehabilitation system, Balo balancing, and Tiger cycling. So HP Cosmos locomotor with an airwalk, robo walk, and for example, MTD balance, and last but not least, the mind maze 3-dimensional virtual reality. So today we're gonna talk about the G-WALK. And what is G-WALK? G-WALK is a digital tool that provides objective data in a quick and easy way necessary for an objective assessment of the walk. So what you here can see is the G sensor. And the G-WALK allows you to measure the progress of the gait before and after a given treatment or the intervention of the exercises. And of course, this is fundamental in the clinical practice to evaluate the efficiency of the rehabilitation path. So now we have an evidence with the objective data. And for me, in the clinical practice, I think you all know, the compliance of the patient is the most important to have a great outcome in therapy. And we have 2 points to get the patient in action, in motion with his emotion, because instead the suffer pressure, or it is the second which gets the patient into action, the enthusiasm. And in my experience with the patients working with G-WALK, we have a big motivation, inspiring and resulting in motivation with the G-WALK. They see the progress. Also, we can share the results with our team, yeah. So we can discuss about making an update of the therapy or change the direction in the rehabilitation process. So provide evidence is very important. For example, we had the case of a patient. She obtained reimbursement from her private insurance. The example was the FES, functional electric stimulation. We showed that much benefit for her in the gait with G-WALK before and after, or in other words, with Bioness and without Bioness. And yeah, so we had the objective data. So how does G-WALK work? Here you can see we have 6 opportunities of assessments. We have the walk test. So we can have nice objective data about the gait phases, stance, swing phase, symmetry index, propulsion index, we mention in a few minutes. Second, we have the timed up and go test. It's very important, especially the geriatric patients. We can interpret the performance in the daily life activities. We have third, the 6 minutes walk test, and there also we can have an interpretation, a clinical report about the performance of the physical performance and the resistance of the body, of the patient's body. And the fourth test is the turn test. The turn test is important for especially neurological diseases, for example, Parkinson's disease and multiple sclerosis. Are the patients able to turn the direction during their gait, or are they just able to move a straight direction? So that's also in my clinical experience an important test. And so the fifth test, it's the running test, and the running test is more considered for the sports athletes in sports physiotherapy. We also had an interpretation and objective data of the performance of the sport athlete's body during the process of rehabilitation. And the last and sixth test of the G-WALK is the jumping test. Jumping test also for sport athletes in orthopedics, for example, with ACL reconstruction on the knee would be a great test. So today we will focus on the walk test. The clinical evaluation of the gait is fundamental to demonstrate the functional benefit of a given treatment. Yeah, so we do the G-WALK walking test pre-therapy and post-therapy, and it also is fundamental to quantify potential alterations induced by aging and or neurological, orthopedic, or geriatrics pathologies. For example, geriatric patients. Yeah, we can measure the cadence, the frequencies of the steps per minute, and with the G-WALK we have the objective data and also the cadence, the decrease in the frequencies of the step per minutes would be an interpretation that the risk for a fall is that much higher, yeah, in geriatric patients. And so we have the opportunity with the G-WALK to point that out. So here we have a video of the acquisition procedure of the walk test. Here you can see the G sensor. Let's look again. Okay. So, how does G-WALK work? We have the clinical report you can see here on the slide. At the end of the acquisition procedure, the software of the BTS provides a complete clinical report. Now we focus on the walk clinical report, and this test allows us the assessment of the gait cycle phases. I mentioned the swing and the stance phase, also the spatiotemporal parameters, for example, speed, velocity, and the cadence, the frequencies of the steps per minute. Very nice. We have the symmetry index and the propulsion index, also an objective data about the pelvic angles during the gait. Now, let's talk about the clinical cases. We have here first a female patient. She's 59 years old and with the diagnosis of multiple sclerosis. So let's have a look on her gait. So we can't see that the gait is impaired. That's without the BIONES functional electric stimulation. And that's the video you have seen. Now we have a look on the clinical report of the walk. So you see highlighted the color in red and green. Now let's focus on the right side, the symmetry index. The symmetry index in this clinical report would allow us an interpretation of the ability of the patient to accelerate his center of mass forward, yeah, symmetrically. Yeah, here we can see it's decreased because the color in red, and she has a value of 74.3%. So she is more centered, more with his mass on the right side. Looking on the propulsion index, we see the left leg. Yeah, we have a value of 6.2 is highlighted in green, and a value of 2.8 on the right impaired leg. Yeah, so the right leg we see, and the propulsion index is decreased, colored also in red, and the propulsion index allows us to have a more detailed look on the behavior of each limb, yeah, left and right, and also the balance between. So here we have a big difference, up to 3 would be very high. Here we have a difference between left and right of 3.4. So it's not quite balanced between left and right. We have a look on the quality index, left walk quality index, and also it's highlighted in red. We see 78%, and I have to mention it's a synthetic index. The stance phase covers 60% from 100%, the swing phase 40% of 100%. So we have the relation between stance phase and swing phase. And normal, I have mentioned, she has a stance phase of 50 and also a swing phase of 50%. So it's near the same time. Have a look deeper below on the table on the spatio-temporal parameters. We can see the cadence. There we have a value of 87, and the speed meters per second with 0.95. So, and here is the walk with the Bioness functional electric stimulation on the right lower limb for the dorsal flexor. So let's have a look. So we have the opportunity with the video, and I think the differences are obviously, we can see it. So the clinical report with the Bioness, first we see it's highlighted in green. So let's point it out. The symmetry index, an index over 90% would be considered as healthy, and she has a value of 93.9%. So great difference with the Bioness. Yeah, objective data, evidence, it's a fact. So, and also very nice, the propulsion index. We see it's more balanced between left and right. The right leg is more able to push the body forward, and the acceleration is that much better. The difference between left and right would be now a value of 1.6. Yeah, so it has decreased, and more balance between left and right leg. So and having a look on the quality index, the left step, you can see 99.1%. So it's quite perfect. You couldn't make it better. The stance phase, it's near 60%. The swing phase is 40% as considered as normal. So big improvement, and also an improvement we see on the table below. The cadence has improved up to 100, and the speed meters per second has also improved to 1 and 11. we can see comparison. The cadence is now 100. Before it was 87. Okay, so and now we have a comparison of the videos. Yeah, often I have to look the videos over and over and over, and I have difficulties to have my interpretation. But with the G-WALK, it's clear. So now let's have a look again without bias, especially on the speed. Yeah, so and with the bias, functional electric stimulation, also we see more balancing in between the left and right step. So the stance phase on the left step on the left side has increased, and the swing phase of the left step has decreased to normal. So my interpretation would be that she's more able to have a better intercoordination, intermuscular coordination between the plantar flexors and the dorsal extensors on the left, on the right lower limb. So the second clinical case, we have an 8-year-old girl. She has a hemiparesis on the left side, leg, and the arm because of a birth complication. So let's have a look on her gait. And also have a look on her rolling off phases on the left side. Yeah. We have to have a close look, but the ability of the dorsal flexor and the plantar flexor on the left side is decreased. And so we have the clinical report. Now we see it here clearly. The symmetry index, okay, it's colored in orange, 85%, and the propulsion index, it's colored in green. She walks very fast. We see it on the table below. The speed meters per seconds are 1.77. Yeah, 1.33 is considered as the normal value. So she walks very fast, and the propulsion is quite good. It's but the deficit we see here is the big difference, yeah, between left and right. So we see the propulsion of the left leg is decreased. So and the difference between left and right, yeah, we could see it's 4.2. It's over 3. So the difference is considered as impaired and not healthy. When we have a look on the quality index, the left step, we see a quite longer stance phase, near to 70%, and a shortened swing phase, about 30%. So, and when we have a look on the clinical report post-therapy, we see that much difference. And to mention, the therapy was 20 minutes. We have that much improvement in the symmetry index. We see here a value of 90%, all colored in green. And so that would be considered as normal. The propulsion index is more balanced between left and right. The propulsion index right decreases, the propulsion index left increases, So we have more balancing between the propulsion left and right. So whatever we have done in the therapy, unspecific exercises, her body and the body's compensation automatically has the result in balancing the propulsion index left and right. So also the left step quality index, we have a look, big improvement, 94.9%. So the stance phase decreases more to normal, the swing phases increases also more to normal. Yeah, so that we see here. And to mention what exercise we did the treadmill for 12 minutes with speed of 4.5 kilometers per hour and decrease 4.5. Yeah, and so it's a kind of strengthening training, especially the calves, the gastrocnemius and the soleus, and yeah, she did automatically a very good compensation. Obviously, on the objective data of the G-WALK, we can see it. Also, we did exercises, side steps on sliding pads. Yeah, side steps, side steps, side steps. Kind of jumping exercises focused on the left leg. In 20 minutes, we have this result, and that's great. Yeah, to have this fact on this objective data for me and also the patient. So the third and last clinical case is also a female patient. She has multiple sclerosis, 33 years old, an impairment of the gait. You will see it. So what you can see. Yeah, the common goal from the patient and me was to get more stability in the core, walk more symmetrically, because she has a big shift with, say hello, to the left side. So the hip abductors obviously are impaired more on the left side. So let's have a look on the clinical report. We see here the symmetry index colored in orange, propulsion index colored in orange, and the value of 83.2%. Very nice balanced propulsion index between left and the right leg. But we try to more strengthening the propulsion, the ability to accelerate the body forward. Yeah, especially the left and the right leg. So, and when we have a deeper look to the quality index, we see it's quite in the range, but we see a big change in the clinical report after the therapy. I have to mention the therapy here in this case was 50 minutes. And let's have a look on the cadence on the table below and the speed. Yeah. So, and most important in this therapy was showing the G-WALK. We see the stride length in meters and highlighted in red the right value of 1.15. Yep. So we see the step length of the right leg is shortened. So we come back later. That's the exercises we did. So we did core stability. She has to pick up a ball and throw it back in my direction. To mention, before half a year, she wasn't able to pick something up from the ground. So, and now she's able to have the core stability to pick up the ball and throw it back in my direction. The second exercise we did some activation for the one leg stance. She has to tip with her toes on the ball, left and right. So we have the exercise with the side steps. Yeah, she has the support of the arms, they are free, and we have a little competition, and it was more difficult for her to keep the tablet, the body, the core are blocked, and my thinking was that she has to work more with her hip abductors musculature. And the last exercise, we see it here, we did deep squats on the climbing wall, also focused on propulsion, yeah, acceleration. Okay, so, and what shows the clinical report? Let's see here, that's the gait after the therapy. So what do you see? Yeah, the goal was that she goes during the gait more symmetrically, less movement, shift on the left side of the pelvis. Yeah, and I think we see the difference. Okay, so the interesting thing, now we have a look on the clinical report after the therapy. And now that could also an interpretation of the clinical report. We have massive decrease in symmetry index, it's colored in red. Before it was approximately a value of 80. So yeah, also the propulsion index, it's not that balanced. Yeah, we have an improvement on the left propulsion, but not on the right propulsion. On the right side, we have a decrease. So, and also more unbalancing. So, but what is quite good, the quality index, it's that much better, because we have a value of 98.1 on the right leg. And if we see here on the table below, the stride length in meters on the right value, we have now a value of 1.27 instead of 1.15. So, and my thinking was to maintain the quality steps during the therapy, which we have shown in the G-WALK, and fundamental on this, we try to maintain the symmetry or improve the symmetry and the propulsion, maintaining the quality index, the quality of the steps in relation stance phase and swing phase, left and right leg. And we did it yesterday, and it works very well, because it was the first time she did before the therapy quality index over 90 left and right leg, and also the symmetry index has improved, not decreased. So, and yeah, that was my goal, with the help of the objective data, the G-WALK, to maintain the quality steps by or during increasing the symmetry and propulsion index. So yeah, here at last we see the videos before and after. So we have a look on the pelvis, and also the right step is that much longer. But also we see she has sometimes some difficulties after the therapy during the gait, because she's not used to it. But it's all a compensation. So say hello or ciao, and yeah, that was it. You have listened to me 35 minutes. I want to thank you for that. Yeah.
Christian, I would like really to thank you for your time.
Yeah. Thank you too.
It was very, very interesting, and I hope we can eventually in the future repeat this opportunity, eventually speaking about other arguments.
Mhm.
Thank you very much.
Okay. Thank you for listening.
Bye.
Bye bye.